Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to look at grief in children, and joining me is Barbara Bilderback. She is the bereavement supervisor at St. Francis Hospice. Welcome to the program, Barbara.
Good morning.
Now I want to begin with you by sort of highlighting the umbrella of grief and the grieving process, and then taking it from how we should look at that and then into children. So in general, many of us have heard about the grieving process. What are the elements of the grieving process that we know you and I and others were established by Elizabeth Kubler-Ross? Tell us those 5 different categories and then take us into how we should look at them today.
Okay. Yes, and we have a lot to thank Elizabeth Kubler-Ross for, because she really opened up this field of death and dying, and there was more to it maybe than we thought. And originally she did identify what she called 5 stages of grief, and that started out with denial.
Okay.
Then there was anger and bargaining and depression and acceptance. And over the years, people maybe got a misunderstanding of what she really meant, and thought that those were 5 discrete stages that everyone had to go through, and that you could identify where someone was and you should maybe try and help them get to a certain stage. We really know now that that's not the most helpful way to look at grief. It really is a process. It's not an event. It will take varying amounts of time for each individual, depending upon their age, their life experience, many factors. The stages she identified are certainly feelings that people experience during grief. They may experience parts of them all at once. Okay. They may be jumping around. There may be a lot of overlap. So we see grief now much more as a dynamic, a malleable process that's going to be affected by one's everyday life and ever so many factors.
And that's really important to keep in mind, because sometimes when we might see a person who is in the grief process, we may say, well, they must not have really cared very much because they're not doing this or they're not doing that. Not taking into consideration, like you said, those are just sort of generics, and different people are going to experience things differently, have different reactions, stay in things at different time frames based on all of a number of factors that we may not even understand, and culture can impact that greatly as well.
Absolutely. Age, I mean, every person's grief process is unique to them. Okay. There's many commonalities, but every person's grief process is unique and personal and highly important.
Now, when we focus on children, a lot of times with children, I know that you hear people say, well, I don't really want to talk to them very much about that loss, or they really don't understand what's really happened, or they're really too young to really be affected by that. Tell me what's not quite on track with that kind of thinking.
Yes. Well, maybe our actions are being ruled more by our hearts there than our heads, because we all want to protect our children. We don't want to have to see them hurt. But grief is a universal, and one of the sayings we sometimes use is if you're old enough to love, you're old enough to grieve. So even infants, in their own way, if someone very close to them has died as a caregiver, as their caregiver, they also will experience grief. Children can cope with what they know. They cannot cope with what they do not know. Okay. And children are very astute at picking up the tone of the household. They're quite aware when adults stop talking when they walk into the room. They're quite aware that there's whisperings going on. They're aware that other people are not acting the way they always did. And when children don't know what that is, that just leaves them only their limited life experience to fill in the missing blanks. Okay. And because as adults, we spend children's whole lives teaching them about big things in life, about manners, about safety, about sex, about religion. Death is just as important. So we believe now that it's important that children be taught grief and about death as they experience it in their lives.
Okay, and we're going to walk through some pictures and look at developmental stages and what do we need to do? But one thing that sort of keyed in there for me in terms of what you were saying is that if we don't give children the information that they need and understand what they need and incorporate them, then that's oftentimes when you get kids thinking, well, I said this to that person, and so it's my fault that they're no longer here, or I caused that to happen. And you don't even realize the child may be internalizing things to that level because, like you said, they're just going by their limited experience. That's all they have is what I must have said something, or I remember the day I wished they would go away. And it finally happened.
Yes. If we don't talk with children about this and engage them in conversation and let them teach us about what their own grief experience is, otherwise we just leave them all alone with some very big feelings.
Okay, well, let's look at one of our first pictures here in terms of and the age of this particular child. What is this picture?
Have a couple of pictures here just to give us another little window into the child's grief. Remember, children, one of the problems or dealing with grieving children is they don't have the verbal skills yet to talk about this. We struggle as adults to talk about our grief feelings. But children, once we ask them to draw things, very often that's where we get a really big window opened into what that child is experiencing and struggling with. I love the saying that something about if you want to walk in another's shoes, you must first remove your own.
Excellent, excellent.
So if we want to understand the child, we've got to kind of take off our own shoes and see it through their own eyes. This was a picture drawn by a girl about 7 or 8 years old, and we were asking the children at that time just to draw a picture about their grief. Well, notice this little face filled this whole page. Look at the huge size of those tears. Look at those very bloodshot eyes. Look at that huge mouth that's crying in some sort of anguish. And she was able to print the words sad there.
Now when we see this, okay, let's say this is a 7-year-old, as you mentioned, and like you said, for us to use drawing as a tool, sometimes we don't think to let the child draw. But if we see the child is drawing this and we're the parent, let's say for instance, how, Barbara, do we respond to it? I mean, do we really, because we don't want to sometimes, do we really ask them what is that meaning to them? Explain what you just drew?
Yes, they're very good at telling you that. And we don't say, oh my goodness, you know, does that red mouth mean your mouth is sore? And it has some blood in there? No. So you can say to the child, I just noticed that the mouth is very large, and you've used a color of red. Why did you choose red for that color? I noticed the eyes have red lines in them. What does that mean? Do your eyes ever have red lines in them? And they're able to explain it to you.
Now when they do, and I'm going to take a really quick break and I'll come back to this, but when they do explain, when we come back, I want you to respond to what do we do with their explaining? Because sometimes our tendency is to, it'll be all right. It'll be all right. But I want you to tell us, as we're getting these responses, now what do we do?
Okay.
Please stay with us. We'll be right back.